My name is Dr. Kaylin Good, and I'm the developmental optometrist here at Good Eyesight Optometry and Vision Therapy. I wanted to take a little time out today to just go over what vision therapy is, or what we call vision rehabilitation, and why it can be important in cases of kids that are struggling with vision related learning difficulties. So we'll get started. First, I want to take time to differentiate between the term eyesight and vision, especially in our world. They are very different, so it's important to kind of talk about this. So, what is perfect eyesight? A lot of people would say, oh, 2020, I've got 2020 vision, I've got perfect eyesight. But is really 2020 enough for being able to learn efficiently? Maybe not. So visual acuity, that term 2020 that you hear, it just measures the ability for the eyes to see clearly at that testing distance of 20 feet. So of course this is important. More clearly the patients are able to see, hopefully the better off they do in learning. But there are other pieces to this puzzle, and that's what we're going to go over today. It doesn't necessarily tell us anything about how the visual system is running efficiently and whether it's equipped for learning. And then also glasses and contact lenses can help visual acuity. So that's kind of our first step. But in patients that have 20/20, maybe even not with glasses or contact lenses, they may have undiagnosed vision problems that can still interfere with learning. So, what is vision? Vision is this nice interplay between the eyes and the brain and how the brain interprets its visual information. So, visual skills are learned throughout development as well as adults, and I think that's important to know. And more importantly, to interpret what is seen, our eyes have to work well together and see it clearly and single and in proper unison. So, you can see here those eyes working really well together as they're crossing and uncrossing. So here, what do you see? This is a great illustration of what we term vision here in vision rehabilitation. So if you can't see anything, that's actually a cow. So I'm going to go back to this image, and now it's virtually impossible for your brain not to be able to visualize this cow now that it's seen it. Perfect. So the difference between sight and vision. First glance, meaningless shapes, that's sight. How our brain organizes that information and interprets it, that's the term vision. That's that cow that you're seeing. Let's go over the building blocks of vision. I think this is also important to know. So we have our visual foundation here. That's our 20/20 vision. It's also our eye structures. Do we have glaucoma or cataract? Anything involved, this is our vision foundation. Here is our body foundation. This is also very important in vision, and in vision rehabilitation, we may work on some of these areas. Then we go to our spatial foundation. So, how well am I able to interpret my space in relation to myself or maybe other objects in the room? So, that's our spatial foundation. Visual efficiency. This is the big thing that we work on in vision rehabilitation. So, we train our brains to better fixate, follow, fuse, and focus. And we'll go over all of these in depth. And then visual perception is really the brain's ability to take in that visual efficiency information and interpret it in an appropriate way. And then once we have all of these basic building blocks for vision, then we can excel in these life activities like school and work and play. Perfect. So what does eyesight not tell us? It may not tell us about other symptoms that we're experiencing. Headaches after reading, print blurring in and out of focus, loss of place when reading. If you've got a child that really needs to use their finger in order to keep their place and they can't do it with our eyes, there may be something else at play. And double vision while reading. If your child or yourself are feeling like those words are kind of splitting into two and then coming back, maybe eyesight is not telling us the full picture here. So these are types of vision problems that affect learning. We'll go into all of these in depth, so we'll just put this up for a second and move on here. So ocular motor skills or tracking. So, our first ocular motor skill is actually fixation. It's the brain's and the eye's ability to turn their eyes into a target and then maintain that focus over a period of time. So, signs of poor fixation for patients: poor eye contact, lack of focus, they're not necessarily looking at the camera, and may have difficulties decoding words. Pursuits are those slow eye movements as we ask our patients to follow a target without doing this or opening our mouth. And signs of poor pursuits are unable to catch a ball, poor handwriting. Ocular motor skills, our third skill is saccades. Those are the quick movements where we go from word to word to word to word, all the way at the end of the line, and then a quick switch back to the end of the line. Those are those small jumping eye movements. So, signs of poor saccades, these are a big one in learning: losing place, skipping, or loss of place, that necessity to use your finger to keep your place. If we've got a kid that's moving their head excessively to be able to track something, that's another sign. Slow reading speed, poor comprehension, maybe rereading those lines consistently. Those are signs of poor saccades. Now we move into fuse. And so that is binocularity or our eye teaming skills. It's really the ability for us to bring those eyes together and maintain fusion or focus on a single image. Eye teaming deficiencies can be convergence insufficiency, so not being able to move those eyes all the way in towards the target and maintain that. Convergence excess may be too much, not being able to move them out when needed. And then strabismus is if it gets to a point where one of those eyes is turned in or out for an extended period of time. So signs of an teaming problem: double vision is probably our primary, excessive fatigue, closing or covering an eye, and that's our adaptation to not be seeing that double vision. Avoidance of near tasks, poor attention span, maybe leaning, using our hand to cover up, those sorts of things. This is kind of an exaggerated demo on what convergence insufficiency can look at like for patients. So it's really blurry, and especially in kids, they may not interpret this as actual double vision, but it is. Those words are trying to double and they create really, really blurry vision for us to be able to understand something. So those are all the typical symptoms of convergence insufficiency, and it's just one of our most common binocular vision disorders. Good. This study just goes over, how well an office vision therapy can help with convergence insufficiency. And then I also just want to take a quick note that ADHD plays a huge role in this as well. Children who are diagnosed with ADHD are 3 times more likely to have convergence insufficiency, and vice versa. Patients with convergence insufficiency who have been diagnosed are 3 times more likely to have ADHD. So, just one more reason why, if we've already been diagnosed with ADHD or we're suspecting it, maybe there's a visual issue at play and we need to get that taken care of as well. Okay, moving on to our next eye skill is eye focusing or accommodation. And so this is the ability for those eyes to quickly switch focus from looking at a distance target to getting it clear up close and being able to do that task all throughout the day. That's what's required for learning as we jump back and forth between our whiteboard and our desk at school. And so dysfunctions in accommodation can create blurry vision and confusion with letters too. They might mistake tell for tall, things like that. So obviously the intermittent blurry vision, they may experience eye fatigue or brain fatigue, headaches while reading, and this is a good simulation as to what accommodative insufficiency would look like or an accommodative or focusing dysfunction. So you can see it's going to be pretty difficult for that kiddo to get through that passage if it's just going blurry and clear, blurry and clear. So those are our basic efficiency skills. Now that the eye has the ability to take in that information, we also want the brain to be able to interpret it in the correct way. And this is what we kind of deem visual processing or visual perceptual skills. And so directionality is a big one, the reversing of letters, numbers, having difficulties understanding between lefts and rights. Visual discrimination is really the ability to determine distinctive features between similar objects and maybe their differences. So discrimination delays can result in similar words being misspelled or confusion like was and saw. Visual memory. Memory was really the ability for us to remember a form, a letter, a number over a period of time. So copying from the board is a big one for visual memory, remembering sight words, spelling, reproducing shapes or images. Visual size and form constancy. It's really just a judgment of distance, size, of shapes and forms. Sequential memory is the ability to remember forms in a correct order. So this especially becomes important when we're spelling and then also in math equations. Visual closure. That's the ability to visualize a complete whole when given only incomplete information. So kind of that whole picture. And then visual figure ground. That's the ability to locate a specific form that we're asking in a very busy visual environment. And deficits of this can lead to confusion and difficulty with scanning text. So, how do we help? We perform a series of in office vision therapy techniques or vision rehabilitation techniques to better train the brain to give the correct instructions to the eyes. So, remember that it's learned and we can train our visual skills. We're not strengthening any eye muscles, they do what they need to do. It's not like physical therapy. And then remember, it takes coordination of multiple areas in the brain for an individual to create clear and single vision. We use a variety of techniques. We use Polaroid glasses, which look like something like this, separates the two images between the two eyes, and we can do fusion testing with Polaroids. And then also we have red-green glasses, very similar, kind of separate those two images. We can do a lot of anti-suppression training with this. We also use prism lenses, which look like this, or they look like flippers to help train fusion. And then we also have accommodative or focus lenses that look like this to help increase or decrease our focus. So those are kind of our free space activities. You can see some patients doing some free space activity work here. We've got a rotator. We've got a Marston ball right here, our Brock string, some red-green targets on the wall, and some vectogram fusional testing. And then we also have computer-based programs as well in our office. We use kind of a distance 3D target training system. We have a touchscreen system, which is very popular in those younger kids. We do have a virtual reality system here as well. It's really to help once those kids have developed a good foundational system for their vision to understand depth and perception. And we also use this in cases for eye turns and lazy eyes. And then this is an eye tracker system, so it gives the patient some visual feedback as to what their eyes are actually doing. Good. I'll just take a note here as well. Patients who have had any sort of acquired brain injury, like a concussion, a traumatic brain injury, stroke, those sorts of things can also have a lot of visual deficits. So just want to take a time for that. And then how do we measure success? So obviously our clinical measures, those numbers will help us determine if we're making the right gains in therapy. And then most importantly, we do symptom surveys and look at patient performance as well. So that's how we measure success in our office. And this is one of my favorite graphics for vision. It just kind of goes over how eyesight is one piece of the puzzle, this one right here, but there's so many other visual skills that are important for learning, and we really do kind of have to master all of them to become successful in school. All right, and I do generally have a bunch of demos when I'm doing these in-person talks, but this one is kind of a fun one if you know how to converge or cross your eyes. You can cross these images to create a third set of circles in the middle. Some people will have help if they put a pen up and they point their eyes at that pen and then kind of slowly walk their eyes back to that third image. And then once those eyes are crossed and they can create that third set of circles clearly, then they're able to see that fun depth or 3D vision pop out. So thank you for listening. I hope that that helps answer some questions as to what vision rehabilitation is and how it's so important in learning. Perfect. And then if you want to contact our office, this is our information here. Or if you're not in the area, then certainly feel free to go onto the COVD website and see if there's any practitioners around your area. Thank you so much and have a good day.